Director of Policy at the NHS Confederation. Good evening to you both. Could it work, you know?
No, it absolutely cannot. Where are you going to find 5,000 GPs when we're struggling to provide safe service Monday to Friday?
Do GPs, or rather young doctors, still want to become GPs anymore?
No, they don't. Looking at the latest recruitment figures, 1 in 3 GP training posts are vacant in this country.
Johnny, I know you said a 7-day week in the NHS is only achievable when we think differently about NHS services. Clearly we need to think differently about recruiting GPs. What else do you mean by that, though?
Well, 7-day services need us to look at the whole collective health and social care experience of people. We can't just look at hospitals and increasing their availability, delivering the same service 24/7. We've got to look at how we support people at home to keep them well and keep them out of hospital.
Is it a problem, though, that whichever party or parties is in government, dealing with the NHS seems like such a mammoth task that they're almost put off addressing those difficult questions?
Well, it's an international problem in terms of trying to develop safe 7-day services. And within the NHS, I think it's trying to get the balance right between when you need to do something nationally, when you need to support your local leaders working across health and social care to get the right services for their local people.
Of course, nationally, when it comes to healthcare, it doesn't really exist. If you look at the United Kingdom, things are done differently in Wales, Scotland, Northern Ireland, as they are in England. This is specifically we're talking about in England. Having said that, in the other countries of the UK, they don't charge for prescriptions anymore. They do in England. Should any of them charge to see a doctor, for example?
I think they should. I think we've come to that point where we should be considering charging for services. Even if we're charging £5 or £10, it's going to deter those who come with minor ailments who could easily just see their pharmacist. Because we've got to free up the appointments for those who are seriously ill. GPs are worried they're missing diagnoses, and because there's such a shortage of GPs, we can't provide enough appointments for everybody, so we've got to discriminate.
Johnny, what do you think?
GPs play a critical role in keeping people safe and healthy and out of hospital. If we end up charging for that, potentially we deny access to the people that need it most. And most of the international evidence suggests paying to see your GP denies people access to critical healthcare.
And these are the difficult questions, though, aren't they? The idea, and people, blanch when you mention it, that the NHS could be in some way privatised or privatised by the back door, with people having to pay more if they can afford it, so those who can't get what they really need.
I think the values of the NHS being free at the point of delivery and not based on the ability to pay is something we'd all want to see continue. I think the key is how can we support people in terms of making decisions about how they can support themselves with their healthcare without needing a health professional.
So do you think making those changes that you talked about, those big fundamental changes, could perhaps even save money in the long run?
Well, I think there's an amount of money that goes into the NHS that's determined by the government, £115 billion at the moment. And the key is not so much how much we save, but how do we spend it to get the very best value from it? That's what we need to be working to do.
In the meantime, Una, just briefly, how do you keep, if you can, attracting those new recruits, those new GPs into the NHS when other countries and other models, private models, are attracting them or seem more attractive?
Well, that's a problem. So what we have to do is talk to these young GPs and provide them with a solution, portfolio career, where they do part NHS and part private. That might keep them in this country because some of them are going strictly private or some of them are emigrating to Canada or Australia. We're not keeping our UK-trained GPs, doctors in this country.
Okay, thank you both very much indeed.